So moving on now to Graham Jones. Graham is chairman of the West Berks Health and Wellbeing Board. He was leader of West Berks Council for 7 years before that. He's been a councillor for 15, 16 years. Graham is an independent pharmacist contractor with pharmacies in Lambourne and Shrivenham. He's a director of the Independent Pharmacy Federation, and he has won the Unichem Great Business Awards 2002. He's a member of Berkshire Local Pharmaceutical Committee and a member of Public Health and Pharmacy Forum. Graham Jones.
Yes, thank you, Paul. I am, having led a local authority for quite a number of years, I've now very much gone back to my roots and spending most of my time as a coal-faced pharmacist. Most of my time is spent in Lambourne in Berkshire, which will be known to anybody who's got more than a passing interest in the racing. Just a few words about West Berkshire. West Berkshire is an affluent area. It's quite a rural area for Berkshire. But we do have pockets of rural deprivation, and we do have quite a number of different public health issues. We have a higher suicide rate than most of the country. Haven't as yet found an explanation for that. We have a rather odd one in that children going to West Berkshire primary schools, when they actually go to the schools in the first place, they're thinner than the national average. When we turn them out from primary schools to go to secondary schools, somehow they've managed to become larger than the English average. We do have, even in an affluent rural place like West Berkshire, we do have very different life expectancies. If you were to take a walk from Cheveley with the longest life expectancy, a 5-mile walk to the centre of Newbury to Victoria Ward in Newbury, you'd discover an 11-year difference in what people would expect to live, and that's in an affluent part of the southeast of England. From the 1st of April, local authorities have taken over. Well, before the 1st of April, we had a number of functions to do with public health, particularly drugs and alcohol, and some of the tobacco control functions. But since the 1st of April, a lot more areas have moved over to local authorities, particularly, and the big one there being public health, something which we are developing some new responsibilities in. The logic behind that is a much more integrated process and I think local authorities are in a very good position to actually be promoting a lot of the preventative agenda, joining up quite a lot of what local authorities do, be it planning, highways, trading standards. Trading standards are responsible for pretty well the whole of the food chain. All those can now actually be handled in a much more integrated way. The Public Health Challenge, I think it was a few weeks ago, I heard the GP, Philip Hammond, equate the public health challenge that faces the country to a river. We have become, indeed, thanks to very many people in this room, modern medicines and healthcare have become very good at picking people out of the river. What we've got to start doing is stop actually letting them falling into the river in the first place. And that is where I think the government rightly recognise the really big healthcare gains are going to come from. With the Western lifestyle and our very easy access to calories and to food, I think very easy gratification that we can achieve through that, we have got many healthcare challenges which we face today. The reality for anybody who's having to handle healthcare budgets, be it at a CCG or be it at a local authority, we are having to spend a lot more money constantly managing people through ill health. Yes, we're living longer, but we're spending a lot longer in ill health. I've picked out one particular lifestyle disease here, just to emphasise some of the figures. 2012, type 2 diabetes, 7.1% of the population, as of now. By 2025, it's estimated 8.5% of the population will have type 2 diabetes. It actually doesn't look that start there, but then you actually back calculate that. That's a 20% increase in the number of people who will be suffering from type 2 diabetes. And obviously we'll have a commensurate increase in all the other similar issues which are related to obesity. We'll have the same problem with strokes, with heart attacks as well. And you'll see if anybody looks at the Clinical Commissioning Group agendas, anyone looks at the Health Wellbeing Board agendas, you're almost certain to find diabetes being very high amongst the plans for treatment. I'm sure people in the room are very familiar with the sorts of issues that come from diabetes. But the start fact behind some of what's written there, an over 45-year-old with type 2 diabetes is twice as likely to be admitted to hospital as somebody without diabetes. So some real healthcare benefits if we can actually start reducing diabetes. To do that, increased number of health checks, promoting healthy lifestyles, proper diet, proper exercise, reducing obesity, integrated commissioning. And I think this is one of the strengths which comes from the new approach is that local authorities probably have a much greater in to a lot of the local communities for that greater integration of approach. What are health and wellbeing boards? They're probably one of the least understood aspects of the healthcare reforms. Usually chaired by a senior local authority councillor or indeed the leader of the local authority. There's a shared agenda to integrate health and social care. Probably one of the holy grails or the golden thread that we've been trying to drive out efficiencies from. One of the areas where bed blocking, all sorts of issues flow from the inability of healthcare and social care to have worked together properly in the past. And hopefully through Health Wellbeing Boards we'll be able to achieve that. Health Wellbeing Boards are there to set the strategic direction of local healthcare. Again, we've got a local democratic element brought into the Health Wellbeing Boards. Local authorities can have up to half the membership, so there is that elected element directly into the Health Wellbeing Board. The flip side to local decision making, though, is of course postcode lottery. If you're allowing local decisions to be made, different areas will choose different priorities. Health Wellbeing Boards are there for joint working, a holistic, trying to bring together all the different elements. So on the West Berkshire Health Wellbeing Board, we've got local government, we've got representatives of the CCG, we've got a patient's representative, we've got the Director of Public Health. To actually make that more holistic, should we be bringing in the police? The police actually have quite an influence on people's health. The voluntary sector, well, we actually, on our Health Wellbeing Board, we have the voluntary sector recognised. Should we be bringing in other healthcare professionals? Again, challenges we have to face whilst trying to keep the board at a workable level. Wellbeing is one of those much greater determinants to health and something which easily gets ignored. And I've certainly with the GPs I've been working with in West Berkshire, we've had a very positive approach to actually looking at many of the things which lie behind healthcare issues. We've been looking at issues such as I mentioned earlier about our overweight children at primary school, but we've been looking at school nutrition. We're doing a bit of pioneering work, very slightly off the wall, looking at credit unions. How can we support a local credit union in West Berkshire to keep people away from the payday loan companies who are feeding, which can then be feeding into all sorts of stress-related issues, which will end up in the GP surgery. Looking at other areas such as the work of the DAT, the Drugs and Alcohol Action Team, very much key work to actually strengthen the health of the local community. Local authorities, and through the Health Wellbeing Board, local authorities are responsible for commissioning public health. Director of Public Health is now responsible to local authorities. A lot of the commissioning took place in the days of the PCT and has rolled over, but that commissioning is gradually over the coming months and years, those services will be recommissioned at a local level. Health Wellbeing Board is responsible for quite a number of important documents. The Joint Strategic Needs Assessment, very much underlying all the building block of a lot of the local plans. The Health and Wellbeing Strategy flows directly from that and is owned by the Health Wellbeing Board. If you're interested in seeing a Health and Wellbeing Board in action, they do meet they are a public meeting, and anybody is welcome to come along and attend. How do you engage with Health and Wellbeing Board? Well, I think one of the things which is very different about the Health and Wellbeing Board is healthcare, the NHS, the structures and the culture, and is very different to the structures and the culture of local government. Certainly, when I served 4 or 5 years on a professional executive committee of a PCT, and one of the things which I got to understand there is that politicians don't really, the politicians at a local level didn't really trust those that ran the PCT. They weren't elected, they didn't have the responsibility to the electorate in the same way that an elected politician was. On the other side of the fence, those in the NHS didn't really trust the politicians, who had really only ever thought in very short-term objectives. So there are very different cultures, but they are quickly being brought together. Healthcare decisions are going to be made and influenced by local politicians. And so one of the key strengths I can see in this is if you go onto the Public Health England website, or if you go and have a look at your local plans, you'll find the sort of the data taken down to a ward level data, the sorts of the building blocks that local politicians, local councillors will think in. These changes are going to put GPs in the media spotlight, or as I put it to some of my colleagues on the CCG, I'm probably going to be their human shield for when the press decide to have a go at them. Public health. Come to local authorities as of April 2013. The budgets have been allocated, and very peculiar for anybody who's got anything knowledge of local government, we actually do have expanding budgets. And certainly we have, in West Berkshire, we've got about 400,000 more to spend than we were anticipating, and we've got another £500,000 next year. Contrasts very obliquely with the challenges elsewhere in local government, where we've had significantly diminishing resources, and as been talked about by some of the other speakers, very much increasing demands from an ageing population. But the budgets have been allocated, and there is genuine headroom, and at the moment they're ring-fenced budgets, but I think if anyone who's studied the politics of the last few years will realise whether those ring fences are going to last is another matter, and I could quite easily see that being subsumed into the general local authority budgets. But that's spending, and something where I'd encourage anybody who's got an interest in this to start looking at those local plans and seeing how you can actually start delivering those particular local targets. We've got quite a lot of new nomenclature coming to the healthcare system, quite a lot of new three-letter acronyms. From where I look at it from as a chairman of a health and wellbeing board, do I regard the clinical commissioning group as the authentic voice of healthcare? Well, I am a clinician anyway, so as a pharmacist, I am familiar with the much broader spectrum of healthcare. But there will be a lot of members of lay members of health and wellbeing boards who will regard clinical commissioning groups as the authentic voice of healthcare. I think it's very important that much broader perspective of healthcare is actually seen by those by members of a health wellbeing board. And indeed, if you're looking at the wellbeing agenda, that much broader perspective, which encompasses a lot of council work, encompasses the police, the fire service, many other people, that wellbeing work is actually understood by many more people. As Howard Stoke pointed out, I think that the reforms do make the clinical commissioning groups are closer to primary healthcare than the outgoing PCTs. I think there's something very positive in that. From a perspective of a pharmacist, one of the areas we're looking at is how we can work through local practice networks and which are within pharmacy, and local professional frameworks which are cross-professional organisations, looking at how we can work in that wider healthcare community. There's a particular project that I'm working on at the moment through the Pharmacy and Public Health Forum, which is looking at how we can upskill pharmacy for a healthy living pharmacy. In essence, a public health or health and wellbeing centre, somewhere where we can apply consistently, deliver a greater skill of public health services. The future, I think, is a familiar theme here: diminishing resources. Yes, there is going to be less. I'm sure there's going to be less money, certainly over the next decade, than there has been over the previous ones. That means innovative working. It means stop working in silos. Joint working. Certainly an area I'd like to look at a lot more with clinical commissioning groups and in both primary care and secondary care is how we can commission right the way along one care pathway as a single entity rather than all doing it in different pieces. Local relationships are going to be very important. Cross-working between professionals, but also cross-working with politicians. And I'd certainly get to know who your chairman of your health and wellbeing boards, who the major players on health and wellbeing boards are, particularly get to know the Director of Public Health. Look at those wider determinants of health. I think we can all appreciate that there could be huge benefits from moving money from primary and secondary healthcare into public health, into that preventative agenda, but that actually takes quite a lot of brave political decisions. Yes, I think we could all see, 20, 30 years' time, the benefits that would flow from that. But in the meantime, by moving that money, people are going to be wanting their particular operations now, not that investment in 20 years' time. And finally, that's hopefully been a personal perspective from an active politician and a pharmacist as to the public health challenge and how that integration is going with local government and how, hopefully you've got a broad feel for how health and wellbeing boards will operate. Thank you.
Well, thank you very much, Graham. And I don't know about you, but I feel quite uplifted by what I've heard so far. 3 excellent speakers, but we've also heard from the CCGs about service pathways, about joined-up thinking, and we've heard more of the same from Graham. And I think the idea of prevention rather than the cure, it just makes so much sense. I think it's really heartening to see how, hopefully, if all this comes to fruition, that this is an obvious way forward for the NHS and to making people's lives better.